Welcome to the Low Back Pain Lifetime Elimination Program. My name is Dr. Nick Hunter. I'm a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we help people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. Welcome to video 4. Hopefully by now you're feeling at least 50% better. The next exercises that we're going to do are going to be a little more functional, a little more dynamic, so we're going to be moving around a little bit. You will need a little bit of equipment, really only the one thing, which is a broomstick, because we will start to incorporate some standing forward bend. An absolute must movement in life because we have to be able to bend, but we also have to be able to do it safely to preserve our back and maximize as much of these exercises that we've been working on to keep us centered and stable. With this position in the recovery process, what I notice a lot with my patients, when they're about this 50% better, they start feeling like they can do a lot more things and are getting back to all the things that they couldn't do before. So I just add this voice or word of caution for you. Be patient and continue to be cautious and diligent with how you're centering yourself in your core, how you're moving and performing these exercises, because it's still very easy is able to turn back into another flare-up, into another episode of back pain, when it's also very easy to avoid that and not do that. So just be patient, be cautious, and continue to be very diligent with working your progressions and getting ready to move on with your next exercise. Now at this point, you're still maybe having some pain and stiffness in the morning. Getting out of bed that first 20 minutes or so might still be pretty bad. So go ahead and continue to work some of those warm-up exercises or introductory movements before you get out of bed. So as we begin these exercises, we're going to go into a quick warm-up. Go ahead and start on your back. Again, I still like the trunk rotation, smooth and steady. These you should be noticing they're getting easier and easier to do. You're able to go a little bit further. Always start cautiously. We still have some improvement to go, and we don't want to take any backslides. 5 to 10 of those side to side. I like bringing knees to chest. 3 to 5 second holds, smooth and steady. And I always like to warm up and center my core. Posterior pelvic tilt, flatten the back, draw in, pull the belly down, keep it tight as we then start to work in some bridges. Now we don't get lazy here. These bridges, we always make sure that our posterior pelvic tilt is tight, our draw in is engaged, and we're squeezing up through the glutes and the hamstrings. Don't get lazy and start pulling up. If you're feeling this tension across the low back, we're doing it wrong. Pull back, keep it flat, keep the feet flat, and keep the knees right over the ankles. Avoid caving them in as you go. We want to keep them out. Do 10 to 15 of these, smooth and steady, always recentering the core and pelvis and working smooth back and forth. Once you do 15 to 20, go ahead and sit back up again real briefly, because we want to work some of these scapular retractions. We want to encourage these lats to be engaged. So center your core here, hands on your hips, make sure that bucket or pelvis is level. As you then work shoulder blades down and back, always avoiding this common mistake and a lot of this turtle out of the shell mistake that we get. So down and back, 5 seconds. Do this 5 times to warm up these muscles, because we do have an exercise today that's going to need to incorporate these. And you're going to see why it's so important that we engage these lats so that we can capitalize its connection to the thoracolumbar fascia that pulls tight and gives us that rigid stability of our back without fatigue and without anything external. Good. And once you're there, we're ready to begin. Put your legs back flat, knees are up. This next one's called dead bugs, because we make what looks like a dead bug on the ground. Our arms and legs are going to be up front. So what you're going to do is extend your arms and legs just to the ceiling, and then we're going to draw in, back stays flat into the table as we raise our legs. And then from here, we're going to just incorporate one thing at a time. We're going to reach one arm over our head. This all stays flat and down. They've actually done studies on what muscle is activated first when you reach overhead. And if you think it's any muscle in the shoulder, you would be wrong. The first muscle that's activated when we reach overhead is actually the transverse abdominis, because our body knows there is no distal mobility without proximal stability. So you're going to start in this position here. Just reach one hand overhead. I'm bringing this hand down just to make sure you guys know we're keeping this core nice and tight. Everything is in contact with the table. We're drawing in, holding 5 seconds, come back up. 5 seconds, other side, come back up. Everything stays flat and centered. Now, if this feels okay, this is feeling good, we're going to do this 10 times. We're only doing the upper extremities. We will incorporate the lower extremities later on in a future video, but we want to make sure that we're able to keep this chair pose as we begin to raise our arms overhead, keeping our core tight and drawn in. 10 seconds, 10 times, and count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back up and then switch. Repeat this 10 seconds, 10 times each arm. Now, if you notice you need to take a break between, that's totally okay. Endurance is a big part of stabilization. So if you feel like you need to take breaks because we're getting sloppy with our technique or we're losing our pelvic tilt here, take a break, that's fine. Recenter, re-engage, and pick up where you left off. We're going to do that 10 times total, so you have 8 more to do. Once you finish that, press play again. So this next exercise, I'm going to keep you in that same position, but we're going to work on some mobility for the hip flexors. Hip flexors chronically get tight on individuals who are in seated positions for long periods of time, because when we're seated, our legs and hips are bent at 90 degrees. That tension collects as we go to stand up. We now have all that motion that we haven't explored for hours at a time that are going to pull on the front part of our spine. Because of the way that hip flexor muscle comes up and incorporates into that front part of the lumbar spine, it actually pulls and it creates more extension moment through that spine. The more limber and loose that is, the less ability it has to cause irritation across that. Especially when you notice folks who have a lot of pain when they go from seated to standing. This is a perfect stretch for you because it's going to help lighten up that tension. And anytime we can get more passive tension out of those muscles and away from those joints, the more relief and long-term relief you're going to enjoy. So this next exercise is hugely important to loosen up those hips, loosen up the hip flexors for people who find themselves sitting or driving for long periods of time. So this next exercise, go ahead and stay right here. But what we're going to do is we're going to scoot all the way to the edge of the bed. This is going to be imperative that you're on a bed instead of the floor. If you've been doing a lot of these on the floor, get to a bed because you're going to need some space to stretch out our hip flexors. Okay, what you're going to do next is bring this knee up towards our chest and then slowly allow this leg to drop down. We allow this leg to drop off the edge of the table or the bed because we want to get some extension through the hip. Now, as we work extension with the hip, we're also working extension mobility for the spine. But doing it in this position allows us to take the load away from our back and reduce as much strain or load through that spine as possible. So you're going to stay here for 20 seconds, and we're going to do it 10 times. Now, you notice this back, all this is staying flat and level. I'm not actively doing that by bringing this knee up to my chest. I actually structurally do that because I block my pelvis from pulling into a strong anterior tilt. Once you're done with that, if you need to help bring that up, you can. Take a break, but then we're going to repeat that 4 more times. We're doing this 5 times total for 20 seconds. Do it 4 more on this right leg, and then do it 5 times by scooting over and doing the same thing to the other leg. Just remember to pull the inside leg up before you drop the outside leg over. And you're going to do that 5 times total for 20 seconds each. This next exercise that we're going to do, we're still going to be on the table or the bed, but we're going to need to have a little bit of space towards the front end. This is a stretch that we do often when people say like their back is really tight and they just can't quite stretch the muscle that needs to be stretched. This is called the Quadratus Lumborum. It's the muscle that goes from lower ribs to high hip. It's on the side. And why it's so important to loosen up? Because on both sides, these muscles, when they get tight, almost act as a vice. These just clamp down on that spine and cause a lot more passive compression to those discs and the joints which increase pain. This is one of those things where I like to use the example of making deposits into our health bank, because if we keep these tight, we're actually making a lot of small withdrawals over time that accelerate the amount of arthritis we get in our back, the amount of disc height narrowing. If you've had an MRI, it's probably been stated on there you had disc height narrowing or facet joint arthropathy, all these things, degenerative disc disease or degenerative joint disease. These are all things to demonstrate some kind of prolonged decay or degradation to those joints. Very, very common, very, very normal, but the rate, the amount of decline that we experience over time can significantly be reduced by doing some of these things, and this Quadratus Lumborum Stretch is one of them. If we can eliminate this vice, this tension that collects and causes that to accelerate, that decline to accelerate, the more that we can stay mobile and active with less pain. So this next exercise, what we're going to do is go ahead and roll onto your side. And from your side here, make sure your shoulders have plenty of room so you don't slip off the edge of the bed. And what you're going to do is just bring your knees up and let your ankles come off the bed or the table. Now, what we're going to do is we're going to relax this. And you notice as I relax my ankles and let them fall down, this hip actually gets pulled and is pulled down this way. That's the stretch or the opening that we're looking to get on this side. Because then from here, I can rotate over this way, and now I'm getting a full length or stretch on this Quadratus Lumborum. Now, be cautious here because we can overcook this and then we get a little achy in the back. So we're only going to hold 5 to 10 seconds. At the end of 5 to 10 seconds, bring your knees up and then relax. And then we can go back into it. But we do have to be careful because if we overdo it, sometimes we get too much pain and too sore. Some folks who, after getting a massage, they're in more pain. These are folks because some of that tension, some of that passive tension in the back is the only thing stabilizing their spine. They need to retain some of it. This is one that we want to be a little bit cautious of, but do it correct. So again, we're going to bring our knees up, let our ankles fall off the edge of the bed. We need to have this kind of cranking moment that then pulls this hip bone down, and then we rotate away. We're going to hold here 5 to 10 seconds. Keep breathing smooth and steady in and out. On every exhale, see if you can go just a little bit further without any more symptom pain. And then the same way we got into it, we bring our shoulders forward, raise our ankles up, and put it back on the table. Repeat that 5 to 10 times for 5 to 10 seconds. When you finish that, do the same thing to the other side. You can just flip right over. Same thing on the other side. Knees up to the chest, ankles off the edge. Let them fall down so this kind of crank or unwinding happens. Rotate the shoulders back, away, and repeat the same thing 5 to 10 seconds, 5 to 10 times. Listen to your body, make good decisions, and keep breathing. So this next exercise we're going to do in standing, so go ahead and get up. And it's important that we do this because in standing we have in our spinal alignment or arrangement a little bit of extension. Even in standing it may seem like it's neutral, but it's actually a little bit of extension. And so we want to be able to stand upright and get to some extension, but without pain. And so we're going to begin to work into that plane, and we're working in that plane of extension in a loaded position like this in standing. You'll notice in the first video we did these things laying down on our stomach and to work some extension. Now we're doing it in standing. So what you're going to do is stand up, hands on your hips, center your core. When I say center your core, that means we're going to put our hands on our hips, fingers in front, making sure that our bucket is level. And then we're going to easy lean back with our shoulders, lean forward with our hips, and work into extension. Now, be cautious with this. You're still not quite all the way ready for full extension or careless extension. We want to be very thoughtful and intentional with how much extension we allow without getting more pain. We do not want any more symptoms down the leg, and we don't want any more pain in the front. And so keep the core engaged, keep it tight as you then lean back. Notice my shoulders are squeezing down the back. I'm also not letting my sternum bend or flex all the way up to the ceiling. I'm keeping it fairly stable through the low back. Doing so allows me to mitigate as much load in that extension moment of the spine while getting as much mobility through the lumbar spine. So it's a good way to kind of manage how much load while maximizing the most amount of mobility. What you're going to do as you lean back we're going to sit here and hold 2 to 5 seconds. Now you notice 2 to 5 seconds is not very long. Only go as much as 5 seconds. Don't feel like that if you can go more, it's going to be better. Just ease into it, 2 to 5 seconds, and we're going to do this 10 to 15 times. Nice and smooth, nice and easy. This is how it looks. We're talking and counting out loud, breathing softly to ourselves as we do so. This may seem very simple, very easy. It is, but it's also sometimes dangerous if we're not cautious or careful. Good. And repeat that to 15 times. We're going to stay standing. Get your broomstick out because this next exercise is going to help to incorporate how to stay stable through our spine, incorporate our big boom muscles, our glutes and hamstrings, to get us from a bent position back to an upright position. There's a few things that I want to work on with you, and you're going to need this for this next exercise. So get it ready. What you're going to do is put it behind your back, and you're going to grab it so that the top of the broomstick is at least level with your head. I like to go just a little bit past the head just to make sure I have enough room of what I need. And you're going to grab the broomstick behind your head, making sure your head is in contact with it here. Grab the broomstick with your other hand in the small of your back, making sure that your hand does not come off of the small of your back. Now from here, we're going to center that core, meaning that we're going to level our pelvis so it's flat and stable, just like we do here. We're going to level that pelvis, and then we're going to hinge from the hips. This hip hinge is hugely important. You notice as I bend forward, my spine, my head, my low back, all of that stays in contact with the broomstick. So why do we do this? Because commonly when we bend, this is what we do. Our head will come off or break from the broomstick, or we round in our back, and then our low back comes off the broomstick. We want to make sure that as we do, we are hinging from the hips and allowing our glutes and hamstring to be responsible for this return. Instead of all these muscles along our spine, we want to help mitigate how much involvement they have so they don't compress the spine and cause more pain. We want to use these glutes and hamstrings to do a lot of the work because they're our primary movers or heavy lifters. So again, the exercise looks just like this. Hand in the small of the back, hand behind the head. We bend forward or hinge from the hips. Go down as far as you can. You'll feel the hamstrings engage and stretch. And then glutes and hamstrings back up. This entire time, we're holding that draw in. You should be experts at the draw in. Smooth and steady, forward and backwards, just like this. Be cautious that you're not like heavy holding onto the broomstick or heavy on our head and neck. We want to stay stable throughout. We're doing this 20 times. Not really any hold. We're just aware and cautious of where we are throughout these movements. I also like to encourage you as you bend forward, big inhale, and then the return is an exhale. Incorporating breathing into this movement helps to center our core because we draw in that breath, which helps to stabilize our belly across our transverse abdominis muscle. So you're going to do that 20 times, do it about 15 more, and then come back to us when you're ready. So this next exercise, we've already talked about our pelvic mobility, or the effect that we have this bucket and we tip it forward and backwards. What we also have is this bucket that shifts side to side. And so perhaps you've seen people with really bad back, they've thrown it out and they're actually walking crooked or tipped. Sometimes it's obvious, sometimes it's very subtle. And so we need to have some pelvic translation or side glide. So this next exercise is a way to assess where you're at, but then also a way to move into it to encourage more of it. So what you want to do is get close to a wall, hands at your side. I say bend your elbows so you're right at 90 degrees because we're just going to kind of inch our feet, walk all the way over until that wall is right in our way. Now we want to stay as upright as we can, and now that wall is in our way. Put your opposite hand at your hip like this, and we're not going to push with our hand, we're going to more push with our hips and our pelvis. Try and bring the side of our hip to the wall, and you're just going to easy push this way. Now you notice I'm not tipping off of the wall, I'm keeping my shoulder and my arm all in contact with the wall as I just shift or glide my hip to the wall. If you can't reach the wall, that's fine, don't worry about it. Go as far as you can without pain and then hold 5 seconds. Nice and easy, breathe in and out. The other thing as you're doing that is make sure that we're still level or centered with our hip or pelvis. We don't want to be tilted forward or backward in any direction. We want to be level. Think of that bucket, level with water all the way to the top, not spilling forward or backwards. Get that in the right spot and then shift over towards the window.